It is 6:36 now on a Thursday morning. A leader in prescription drug abuse prevention at ETSU's Bill Gatton College of Pharmacy says the Tri-Cities region is an epicenter for opioid overdose deaths. Pharmacy professionals are on the front lines every day combating the issue.
We wanted to know how the Gatton College of Pharmacy is teaching budding pharmacists in our community. In light of this epidemic, News Channel 11's Justin Soto takes us inside one of those classrooms.
The problem with opioids started with treating pain. Oxycodone, hydrocodone, or fentanyl are just some examples of drugs that are abused. In year one, Gatton students are learning about the dangers associated with medications like opioids and meeting patients who are dealing with addiction.
Addiction is a disease.
Step inside an ETSU Bill Gatton College of Pharmacy classroom and you'll find
there's nothing like doing the hands-on and seeing what it's like.
A hands-on approach of teaching students how to spot an opioid overdose and how to get someone out of it, including how to administer the life-saving drug naloxone.
And you hear the click and the hiss.
Naloxone does enable. It enables somebody to breathe. It enables them to get into recovery.
Dozens of pre-pharmacy students listen in through this mentorship program led by current student pharmacists.
And our main mission is safe medication practices for all ages.
In the classroom, day to day, pharmacy students are also learning different ways to manage pain.
Instead of them reaching for an opioid, trying to optimize someone's ibuprofen or Tylenol or acetaminophen regimen.
A lot of times the best way to treat the pain is to try to figure out what's causing the pain and try to fix the source rather than fix the problem.
Overseeing the class, Dr. Sarah Melton, professor of pharmacy practice.
In our region, we're an epicenter of opioid overdose deaths.
Dr. Melton explains why.
Our lower socioeconomic level genetics with family members having the disease of addiction, we know that is a genetic. Injuries with a lot of the factory work, coal mining, those kinds of things. There's a variety of reasons why it's really hit us.
With ETSU being here, do you feel like you guys have a special role in combating this problem?
I do think so. I think people are recognizing that we are very active in the community, so we get calls from the community to come out and serve, like at the RAM clinics, like going out and providing a community training where we're able to bring in free naloxone.
Dr. Melton and pharmacy students are optimistic about the future, saying the next big hurdle is reducing the stigma.
People don't want to even say they're depressed, much less that they have a substance use disorder. So that's another thing we're working on, is really fighting the stigma. This is a brain disease.
And you hear the click and the hiss.
So there's a lot of stigma associated with the disease of addiction, and as soon as we all start treating it like the disease that it is, then we can really start moving forward with the care that we're able to
for you, so make sure that you leave it there since it's an auto injector.
Dr. Melton says another part of this equation is the prescriber, saying Tennessee ranks third in the country for the amount of opioids prescribed. The College of Pharmacy is working on prescriber education, talking to practitioners who are already prescribing, and holding continuing education courses. That's just another facet of this problem.
Thank you, Justin. Now, Dr. Melton tells us the College of Pharmacy is working to bring this naloxone programming to the main campus. They're in the planning stages of making it accessible to dorms and other buildings on campus. And all through the day, News Channel 11 will be taking a look at the opioid epidemic with in-depth reporting. In our noon show later today, we'll be focusing on officer safety.